Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the HIMSS conference, interviewing the industry's greatest leaders about trends in the space. So tell me, who are you and what do you do?
Well, Grace, it's nice to meet you. My name is Chuck Tuchinda. I'm the executive chairman of First Data Bank, and I'm also the COO of Hearst Health. And I'm glad to have an opportunity to talk about our companies and what we do, because I've dedicated my career actually on bringing in clinical information to the point of care for people to make better decisions.
Oh, I love that. And is that what First Data Bank does?
Absolutely. We are one of the premier sources of information, and it's been traditionally focused on medications, and we feel like we have a huge impact just helping people understand what to do with their medications and making the workflows that everyone uses much better and safer.
I love it. Now, what trends are you hearing in the HIMSS hallways?
Last year was all about what can AI do, but this year it's about how do I make AI practical. And so I'm hearing about AI in actual workflows, really trying to make it clinically credible, making it operationally realistic, and that means oftentimes that there's a governance process, and I think that's a new thing that's very important. For us, that often means that you need to trust some content to make sure that the answers you're getting at the point of care really make sense. And so I'm very hopeful that AI will lead us to even better levels of care and understanding.
Oh, love to hear it. Now, I'm hearing in the hallways a little talk about health equity. It's not being talked about enough.
Yeah.
And so I want to ask you, what health equity challenge do you feel is really just underrated or not really discussed?
You know, when we think about health equity, there's a lot of things that still need to be done. And I think we need to chip away at it piece by piece. One of the things that I think needs a lot more visibility is actually around health equity, around patient understanding. And so the example that comes to mind for me is when a patient comes home from the hospital. You can imagine someone with like 5 or 6 meds, maybe a stack of papers, and then hopefully or maybe there's a family member helping them. And I know when I think about my parents, they get confused about what to do now with their meds and what to do next. I think that that's a problem. If you think about it, if they don't know what to do, that's not just an inconvenience, it's a safety risk. So I think that we need to think as clinicians about meeting the patient where they're at. And that doesn't always mean just sharing all of the information we have. You know, I'm a trained physician, and at first I used to think, oh, I'm going to tell them everything I learned in med school and my years of clinical practice. But actually, that can be really confusing. So we need to personalize it so that patients understand, make sure it's clear, really spell it out in simple terms in the language they understand. So that's, I think, the challenge, and we need people to make that better.
Such a great perspective. Now, there's a lot of young people here at HIMSS. If you could give your younger self a piece of advice coming into health IT, what would you tell yourself?
I would tell myself, don't just stay in one lane. So I'm a trained physician, but I had this big fascination with technology and data long ago before actually, like healthcare informatics or health IT even became a thing. And I felt very conflicted about it. When I look at the innovations and opportunities that sort of unfolded over the past decade, I think they really came at the intersection of multiple disciplines. And so what I mean is at the intersection of medicine, engineering, data science, and even design. So I would tell myself that you really want to focus on those intersections where people can collaborate and really make a difference there. I think that that's something that people maybe underappreciate because it feels like it's not a linear path. I think many of us, especially our parents, tell us, go down the straight, tried, trusted, true path. But I think that that's not quite right. Actually, I would say lean into the side paths, follow your heart, be very curious, learn as fast as you can, and that will lead to the major breakthroughs.
Love that advice. Thanks for joining me today.
All right. Thank you very much, Grace.